Hello, my name is Dr. Trevor and I'm the Director of the Maxillofacial Prosthetic MSc program at the Faculty of Dentistry, Oral and Craniofacial Sciences at King's College London. And I'd like to spend a few moments on this video telling you a little bit about the course. The Faculty of Dentistry and Oral and Craniofacial Sciences is an international leader of postgraduate and dental education. It's ranked number 2 globally for dentistry by the QS World University Rankings in 2019. The research quality rated at 90% is world leading 4-star or internationally excellent 3-star in the REF 2014. FODOX is a pioneer of delivering blended learning in dentistry worldwide for over 25 years. Students come from all over, from above 50 countries or so. For the MFPR program, we have at least over 35 countries sending students to us. The blended learning approach combines online learning, clinical practice, and campus activities. I am a reader and honorary consultant in maxillofacial and craniofacial rehabilitation at Guy's Hospital, as well as being employed by King's College London. I'm the program director for 3 MSc programs. The first is Maxillofacial Prosthetic Rehabilitation, and this has been running since 2009 and is a blended learning program. The second, Maxillofacial and Craniofacial Technology, is a 2-year full-time program. And the third is a joint program with Manchester Metropolitan University and is also a blended learning program over 3 years. My research interests are around digital technology in facial prosthetics. And as you can see from this little video, we are printing 3D models of ears and noses in a silicone elastomer, which will be later pigmented to match the patient's skin. The idea here is that these prostheses will be more easily provided for the patient and can be kept on file and provided at a later date of the same prosthesis as was delivered first. We also have a lot of work in terms of colour science. I want to tell you a little bit about the flexible learning program. And so we'll start off by just looking at the sorts of people that can apply for this program. So we're interested in maxillofacial prosthetists who are already in a designated maxillofacial centre and who wish to advance their skills. Or perhaps technologists who've just completed their BSc in dental technology and wish to move into the field of maxillofacial prosthetics. And we also see prosthodontists who are general practitioners who have an interest in maxillofacial prosthetic rehabilitation as well. We use cutting-edge digital technology for intra and extraoral prosthetic facial rehabilitation in our clinical practice. The duration of this course lasts for 3 years and commences in January of each year. Mode of attendance is by part-time, and the format is by online teaching and learning, self-directed learning, and face-to-face training in Pune, India. Most students will be able to access the web, and on this web you will find all the information that you need to carry out the course. So for example, you will have your general resources, your assignment guidance, your practice assignment that you can submit prior to your online assessments. There is information about the face-to-face program, the online tutorial timetable, recorded tutorials of things, for example, like impression taking, and there's also some exam resources to help you when you come to that part of the course. The face-to-face program, as I've said, takes place in Pune in India. The unique part about this program is it gives a very hands-on approach to treating patients, and no other distance learning program in the world has this opportunity. So the Year 1 students spend 10 days and the Year 2 students spend 11 days on the face-to-face program. The face-to-face program consists of lectures, clinical demonstrations, technique work, and hands-on treatment of patient cases. There's also the opportunity with working one-to-one with a clinical tutor, and each student is expected to complete 3 to 4 patient cases during the face-to-face program. In this little clip, two students are actually treating a patient with hemifacial microsomia. And you can see that the patient already has an existing ear prosthesis, which is going to be remade by one of the students. So this session is talking about the design and the position of the prosthesis, and will be discussed with the tutor looking after that student. So just to talk a little bit about the content of the program, you'll see that Module 1 is maxillofacial and ocular prosthetics, Module 2 is patient management, and Module 3 is the research methods. And of course there's the intensive face-to-face program in Pune, India at the beginning of March of each year. In Year 2, Module 5 is the applied science of maxillofacial and craniofacial technology, and Module 6, the psychological and social issues in head and neck cancer. And again, there's an intensive face-to-face course in India. In Year 3, Module 4 is the clinical practice, but this actually takes place over Year 2 and Year 3, accumulating with the presentation of the clinical cases at the end of Year 3. Module 7 is a final year project which would include a dissertation or a small research project. Each of the modules consists of 6 units. So for example, in Year 1 there will be 18 units, and in Year 2 12 units. So just to break that down a little bit more, in Module 1 you'll see that we talk about facial prostheses, ocular prosthetics, digital technology and extraoral implants. In Module 2 it's patient management, colour science, congenital and acquired clefts, patient assessment and prosthesis design. And in Module 3, data analysis, developing a research question, designing a study and writing up your research. Module 5 in Year 2 is looking at craniofacial implants, titanium and bioglass and biocompatibility, materials used in maxillofacial prosthetics such as silicone and silicone gels, and also a small component on tissue engineering and bone substitutes. Psychosocial issues. We have emotional and social impact of head and neck cancer, meeting psychological and social needs, psychosocial assessment and communication, and the impact of working with individuals with head and neck cancers. And in Year 3, the clinical practice consists of completing 4 cases which are videoed from start to finish of treatment. This is presented as a 15-minute video to the examiners. And additionally, a logbook demonstrating the range of facial prostheses that have been made and a reflection upon the challenges that have been faced during those treatments, and a bit on pre-treatment and post-treatment of patients. And in Module 7, as I previously said, is a dissertation or research project of the student's choice, selected along with the supervisor. Okay, so just to look at the assessments over the 3 years, you will see that there are 2 assignments per module, and there are a formative and summative assignment in May and July of each year. So, for example, the formative assignment consists of 1,000 words, and the summative assignment would be 3,000 words. So that would be in Year 1, 3 formative and 3 summative assignments, 1 for each module. There's also a 1-hour exam per module. So in Year 1, for example, there are 3 modules, so that would be a 3-hour exam. There is a 60-40% split between the exam mark and the assignment mark, which is added together to give you your total for Year 1, Year 2 and Year 3 marks. There is of course a compulsory face-to-face training, and you must complete this in order to progress from Year 1 to Year 2 and from Year 2 to Year 3. And as you've seen, the number of days are 10 days in Year 1 and 11 days in Year 2. In Year 3, the research project is made up of 10,000 words, and there is no taught module, but you must submit the clinical cases at the end of Year 3. Well, who is the course for? As I've said earlier in the video, we look for maxillofacial prosthetists who already are practicing in maxillofacial centres around the world, technologists who are interested in going into maxillofacial prosthetics, and also general practitioners who perhaps from their countries cannot practice, and so therefore undertaking this MSc will allow them the skills to undertake facial prosthetic rehabilitation. Hopefully you'd be interested in expanding your area of expertise and technical abilities. The entry requirements, usually for the UK, would be a diploma in professional studies or a degree in dental technology. For overseas applicants, an equivalent dental technology qualification and up to 1 to 2 years postgraduate experience. And also the English language IELTS test with a 6.5 overall with a minimum 6 in each skill. In terms of the application process, applications are open from February through to October of each year, and applicants are applied on a first come, first served basis, which must be accompanied by a personal statement, transcripts and references. And this is available through the online application via the King's website, so apply.kcl.ac.uk. Here are some useful links for you. kcl.ac.uk maxillofacial. So this gives you the course information, the current fees, entry requirements. And there's also the one at kcl.ac.uk distance dentistry, distance learning, FAQs, and distance learning dentistry in 90 seconds overview. You can also contact Distance Dentistry at kcl.ac.uk or through facebook.com King's Dentistry or instagram.com King's Dentistry. I hope this video has been useful in giving you some information about our programme, and we look forward to hearing from you.